Critical care is the most expensive healthcare segment in America. About 1% of the gross national product in the U.S. is spent on critical care services. ICU patients account for 30% of acute care hospital costs, yet only occupy 10% of inpatient beds. There are many benefits to improving your ICU and many ways to organize care. But studies have shown a 30% reduction in length of stay, up to $13 million in annual hospital savings, and the potential for more than 160,000 lives to be saved when critically ill and injured persons receive care from an integrated team of dedicated experts led by an intensivist, a physician credentialed in critical care medicine. This short video will show you why improving your ICU is good for physicians, better for hospitals, and best for patients. The Society of Critical Care Medicine refers to this type of care as the right care, right now. Right care right now means the right care is delivered at exactly the right moment in time to achieve optimal patient outcomes. The rapid pace of the intensive care unit requires that critical care practitioners quickly obtain information, convert it to knowledge, and apply it to the best interests of the patient. The multiprofessional team approach is the most successful and efficient way to do this. The team coordinates total patient care, honors medical treatment preferences, ensures appropriate treatment for all organ systems, and avoids duplication and errors of procedures and medication. The team may consist of experts including critical care nurses, intensivists, nurse practitioners, pharmacists, physician assistants, physician specialists, primary care physicians, respiratory therapists, other professionals, and patients and their families. Good for all physicians? Implementing the right care right now is good for all physicians. Not only are better patient outcomes realized, but many physicians gain financially and experience lifestyle improvements. Patient outcome. The multi-professional team model of care reduces mortality, length of stay, and complications, as well as supports timely and personal communications with the patient and family members. These factors result in better outcomes for patients and their families and more satisfied patients. Financial gain. Primary care physicians and physician specialists may gain financially from an ICU using a team approach. These physicians will then have more time to provide outpatient care in the office, thus creating more billable opportunities. Having an intensivist in the ICU alleviates the primary care physician's burden of caring for critically ill and injured patients. Lifestyle improvements. Having an intensivist immediately available at the patient's bedside substantially reduces physicians' trips to the hospital and late-night phone calls, thus improving the physician's daily lifestyle. Physicians are provided the flexibility to consult and collaborate with the patient's other physicians, usually during regular office hours. The physician's peace of mind also improves, knowing that patients are receiving the best possible care from an intensivist-directed multi-professional team. Better for hospitals? Studies by the Leapfrog Group have shown that large or small hospital ICUs that implement the multi-professional team model can see significant savings. The Leapfrog Group recently estimated that a 12-bed ICU with 940 ICU admissions per year, with an average length of stay of 2.8 days, would spend about $450,000 to implement the multi-professional team model. But the total net savings could reach up to $13 million annually, depending on the size of the ICU. There are several mechanisms through which savings are realized. Additional billings from intensivists and incremental hospital revenues from displaced non-intensivist physicians. Cost reductions by using non-physicians to provide ICU patient care in the evenings and weekends. Reduced bottlenecks and improved flow from the emergency room, operating rooms, and general wards as patient management is better coordinated. Reduced ICU ancillary costs. Reductions in inappropriate ICU admissions and ICU length of stay through ward substitutions. Best for patients? Critical care professionals want to deliver the same care they would expect for their family and themselves. Implementation of the multi-professional team model has shown the potential for more than 160,000 lives to be saved annually in the United States alone. Is there any better reason? Patients benefit because clinical quality improves, post-operative complications and mortality reduce, and lengths of stay are shorter. length of stay and duration of mechanical ventilation are reduced, thereby decreasing ICU patient exposure to infections, including ventilator-associated pneumonias. Low-risk patient admissions are reduced. Post-operative complications are minimized by consistent participation of intensivists in care of post-op patients. Looking for more? For more information about how to implement a multi-professional team in your ICU, please view the real-life success story of implementation, as well as the steps to implement Right Care Right Now in your hospital video on this disc. To learn more about the Society of Critical Care Medicine and Right Care Right Now, visit www.sccm.org or call 1-847-827-6888.